I'm Dr. Brenda Kubheka. I am based in Johannesburg in South Africa, and I work in the field of bioethics and clinical risk management. So I am a physician and with special interest in the business of healthcare and more specifically in ethics. So I'm a co-founder of an organization called Health IQ Consulting. For someone that has worked in this space for quite some time, I think the basic thing is just the understanding of why emergency physicians are working in facilities or in hospitals, basically to save lives and making sure that the quality of life of patients is preserved. So in that situation, there is that challenge of the competing interest as an investigator between being a clinician who's providing a service and also as an investigator that is collecting data for research. So what is more important is to ensure that access to effective care does not get compromised for the sake of research. So where there is effective care that is available, that should be prioritized. And also the health or the lives of patients should not be compromised for the sake of research. And again, in the space of emergency medicine, you know that time is quite critical, and we talk of a therapeutic window. So that again needs to be taken into consideration in the ED space when it comes to research. Yes, when it comes to informed consent, I mean, there's a number of elements that need to be met for consent to be considered informed. But once again, the emergency department presents unique challenges because time again is of essence. So in cases where it is difficult to get consent, or where research is being conducted on vulnerable patients, vulnerable because of the conditions that they suffer from. And that's where there is a need for the IRB to have given ethics clearance. And then what is important is the community participation, where there is engagement and the community also is aware of the research that will be conducted in a facility where they normally go to when they want to access care. So the element of protecting the society and also protecting the vulnerable people in that space is critical. I always say that when it comes to healthcare, we need to keep in mind also the issues of power dynamics. I mean, I come from Africa, and there's variable levels when it comes to, literacy, when it comes to health, and then also issues of, culture coming or creeping into the healthcare space, where you find that certain individuals or populations or communities don't question authority figures. So those are some of the issues that have to be taken into account when engaging with specific populations, so that their unique vulnerability is also taken into account when designing research in the emergency department. So again, it goes to the design, how the study is designed, and the question also that needs to be answered. And importantly, it's making sure that the therapeutic window does not get compromised, where patients do not receive the care they should be receiving, especially when there is effective care. But again, if we're talking about effective care, there's also opportunities where care can be improved. At the same time, we need to ensure that the patient's lives and clinically they don't get compromised for the sake of of conducting research. So there must be safety mechanisms that are actually put in place from the time where the protocol for the research gets developed to getting ethics clearance from the research board and to the implementation. Again, this is a highly vulnerable space for patients because, again, there's an issue of time is critical. And then secondly, we also don't want patients to agreeing to taking part in research when they are fearful and they are not giving freely, they're concerned, but they are worried that if they say no, their care may be compromised, or if they say no, they might not be given, the required treatment or care, or even advice from the medical practitioners. I think for me, the important thing is starting from the premise of emergency medicine research happens in the most vulnerable space because time is of the essence. I mean, we're talking about patients that suffer from strokes that might be worried that they might not survive, patients that are bleeding because they've been involved in trauma, etc., etc. So that has to be taken into account, and those mechanisms for protecting the society and the patients must be upheld and monitored also during the research. I always say patients don't know what they don't know. So starting from that point, it means disclosure is critical. And disclosure, it should be the same amount of information that you as an investigator would have loved to receive that will assist you to make an informed decision whether you want to participate or not to participate. And obviously, it's a focus both on the risks and the benefits. And the focus on the benefit is not just the benefit for the patient, but it's the benefit for the society. Because when new therapies are discovered, the society does benefit. We say prevention is better than cure. So a lot of focus before the actual research gets conducted. One, it's the awareness of those moral dilemmas that will come in that space. And then it's two, it's the making sure that the investigators have the right tools and use the right frameworks to address those issues. And then three, it's the support that needs to be there. And I believe that the research in emergency medicine, it's a combination of research ethics and clinical ethics because it's such a critical space. And also just finding or creating those platforms where those two areas of ethics actually combine. And it must be, the consultations must be available 24/7 when ethical dilemmas are faced, etc. But there's a lot of work that needs to be done and the training prior to the actual implementation so that, the clinicians are ready and also they can actually take care of themselves morally and also psychologically as well. I think that's a very interesting question. It just takes me back to my days in medical school and how much of medical ethics and health law we covered during that time. And honestly, I went into the world of work ill prepared, you know, and a lot of the knowledge and the expertise that are gathered outside of the medical school. So there is definitely a gap, and in the depth of training when it comes to medical ethics, and also just the use of case studies so that it's also more engaging and more interesting. Because when I talk about ethics, you can just see the jaws dropping and they're thinking, yeah, this person is going to, it's boring, etc. But I think it's so exciting. It's just the how also we conduct the training. So definitely there is a gap. And then secondly, if we look at just digital transformation, especially during COVID or post-COVID, and the ethical issues that also came with that, and how it also highlighted the unreadiness when it comes to ethics, just on the side of ethical issues that are related to technology, managing information, etc., and just having the clinicians as the end users also understanding the role they are playing in that space and their ethical obligation as well. And then looking again at the pandemic And in my country, how it highlighted also the issue of digital divide and the availability of technical or digital tools, and then also just the skills, of how to use what we take for granted, even including like telemedicine, and how difficult for other people it is just to press that button or to access that app, etc. So that's where now ethics is actually becoming much more interesting, especially in the healthcare space and in the society, and how it impacts how we relate, and also how we use technology to enable or for betterment of humanity, rather than as a tool to fight each other. I believe the guidelines are there, and the different regions globally are at different phases for obvious reasons. I mean, if you look at the developed countries and the developing world. But what I find for me is, these conversations happening or taking place outside of the physicians, platforms, and yet they are the end users, or we are the end users. So there is a need to bridge that gap, and also to find spaces, in medical schools, to start having these conversations about digitization in the healthcare space. What does it mean? To start having conversations about AI and the benefits of AI, and also the fears. Because if we don't address these, the people who are supposed to be adopting are not going to adopt, because now they are fearful. And also just to have balanced conversation. For example, we hear that now and again it's going to be so easy to disrupt the value of a radiologist and a pathologist because of AI. And now it's like these two specialties are going to die a slow death because of AI. But we don't have, balanced conversations, or create those platforms to have balanced conversations about, yes, AI is there, yes, there are benefits, but there's also limitations. Like, for example, if you think of black box, if you're not able to explain the output, can you really apply it? Issues of liability, that, we create the platforms to have the conversations. Let's hear what the fears are. Let us address the fears, because also when it comes to developing guidelines, they also need to take into account the end user's perspective, so that they are developed in a way that, takes care of future possible hindrances when it comes to, adopting, digitization. Probably a creative artist. Not that I'm good at it, but at least, yeah, maybe I can dance or try to sing or whatever. But I think I'm just appreciating, how they think out of the box, and also how they understand the society more than we do. And they just have different ways of communicating messages. I think, yeah, probably be a creative artist. Who knows? Maybe I will be singing guidelines of TB treatment or whatever, but just finding interesting ways of doing things. Yes.